Welcome to The Explainer. So today, we're diving into a genuinely fascinating piece of medical research that dropped in the New England Journal of Medicine. We're breaking down a gold standard clinical trial that sets up, honestly, a pretty heavy-hitting comparison. We've got a controversial psychedelic compound going toe-to-toe with a standard, widely prescribed daily antidepressant. It's a scientific showdown that could completely change how we look at mental health treatment. Okay, let's dive right into this. For decades now, our whole approach to treating depression has relied on a very specific set of daily medications. But what actually happens when researchers take psilocybin, the active psychoactive compound found in magic mushrooms, and put it into a rigorous, 6-week double-blind clinical trial against Escitalopram, which is a super common daily antidepressant? I mean, it sounds a bit like science fiction, but this is incredibly real, peer-reviewed science.
Here's our fight card for today. First, the mental health challenger, followed by the ultimate scientific showdown. Then, we'll look at the primary results, the secondary discoveries, side effects and safety, and finally, the future of treatment. Let's get into it.
Number 1, the mental health challenger.
So, major depressive disorder is just a massive global health challenge. According to the study, it affects about 10% of the general population. Now, the current reigning champion of treatments, our standard first line of defense, are SSRIs. Escitalopram is one of these standard daily medications. But here's the catch, right? These daily pills can take several weeks to actually kick in, and for a pretty significant number of patients, they simply don't help enough. That gap in effectiveness is exactly why scientists are so eagerly investigating these alternative pathways.
Part 2, the ultimate scientific showdown.
The researchers gathered 59 patients dealing with moderate to severe depression and split them right down the middle into 2 groups. The psilocybin group got 2 large, 25 milligram doses of psilocybin, spaced exactly 3 weeks apart. On all the other days, they just took a daily placebo pill, a total blank. Then you have the escitalopram group. They took real, active escitalopram pills every single day. But to keep everyone completely blind to which group they were actually in, the escitalopram group also got 2 tiny 1 milligram doses of psilocybin on those specific dosing days. That 1 milligram is so incredibly small it doesn't cause any psychedelic effect, but it standardized the expectations. It meant every single patient in the entire trial was told, truthfully, hey, you are receiving psilocybin. Honestly, that's just brilliant trial design.
And remember, this wasn't just some casual experiment. It was a highly monitored 6-week medical process. Patients had to completely taper off and stop their prior psychiatric meds. On those 2 big dosing days, they were carefully monitored in a clinical setting. And here is a totally vital piece of the puzzle. Both groups received ongoing psychological support from mental health professionals throughout the entire trial. The psychedelic experience absolutely requires a supportive context, so therapy was basically baked right into the process for everybody. Finally, at the very end of those 6 weeks, they did a comprehensive depression check-in.
Moving on to part 3, the primary results.
Now, what's really interesting here is the number 2.0. The primary outcome for this whole study was based on a really standard 16-point depression severity test. Over the 6 weeks, the psilocybin group's depression scores dropped by an average of 8.0 points. Meanwhile, the escitalopram group scores dropped by an average of 6.0 points. So the absolute difference between the 2 treatments? Just 2.0 points.
So what does that 2.0 point difference actually mean in the super strict world of clinical science? Well, it means that statistically speaking, there was absolutely no significant difference between the 2 treatments on this primary 6-week measure. It was basically a draw. The challenger did not definitively knock out the reigning champion. Both groups saw the depression scores go down, which is fantastic, but based strictly on this primary metric, the researchers just couldn't declare psilocybin the undisputed winner.
Which brings us to Section 4, the secondary discoveries.
And this brilliantly illustrates exactly why scientists always look beyond just that one primary number. Let's talk about remission, which basically means a patient's depression score dropped so incredibly low that they're essentially considered depression-free by the test standards. Get this, at 6 weeks, 57% of the psilocybin group reached remission. In the escitalopram group, it was just 28%. I mean, that is a massive gap. Now, we do have to be a bit careful here. Because of how the trial was structured, the researchers specifically warned that these secondary numbers weren't mathematically corrected for multiple comparisons. That's basically fancy science speak for saying, hey, these are amazing hints, but we really can't draw absolute ironclad clinical conclusions from them just yet.
But beyond just the math, the actual human experience of the treatments was vastly different between the 2 groups. Patients in the psilocybin group reported some truly profound emotional breakthroughs.
They noted a greater ability to cry, increased feelings of compassion, the ability to actually feel intense emotions again, and just a much greater sense of pleasure in life. Plus, they felt way less drowsy during the day. This is an absolutely crucial point because traditional daily antidepressants like escitalopram can sometimes cause this emotional blunting effect, right, where patients just feel a bit numb to everything. The psilocybin group reported almost the exact opposite, a super vivid return of their emotional responsiveness.
All right, Section 5. Let's talk about side effects and safety.
So, the good news right off the bat. There were 0 serious adverse events in either group. No psychotic symptoms, no dependency issues, nothing like that. But their side effect profiles looked really quite different. For instance, 67% of the psilocybin group experienced transient headaches, usually popping up right after their specific dosing days. But look at the escitalopram group. 14% experienced increased anxiety and 14% experienced dry mouth, compared to literally 0% for the psilocybin group on those specific issues. In fact, 4 patients in the escitalopram group actually had to stop taking their daily pills completely because of the side effects, whereas nobody in the psilocybin group asked to cancel their second dose.
And finally, Section 6, the future of treatment.
So the absolutely crucial point here is exactly what the Antigem researchers themselves stated. Larger and longer trials are required. You know, science is a really slow, methodical process. 59 patients is a relatively small sample size in the grand scheme of things. Plus, a 6-week window is honestly quite short, as escitalopram sometimes needs a lot more time than that to achieve its full therapeutic effect. But look, this trial was an incredible pioneering first step. It proved that this kind of rigorous head-to-head research with psychedelics can absolutely be done safely. It didn't provide a knockout punch, sure, but it gave us some deeply promising secondary data that completely justifies moving to the next round of research. We are quite literally standing on the edge of a potential paradigm shift in mental health care. But getting there, it requires incredibly careful science, immense funding, and above all, open minds. Think about it. If a single chemical compound can effectively reopen the door to human emotion for people who are deeply suffering, what other breakthroughs are just waiting out there to be discovered? Keep asking those hard questions, follow where the data leads, and I'll catch you in the next explainer.